Today we're talking about neck humps. Now another word for neck hump is a Dowager's hump or a Buffalo hump. Sometimes you will hear people refer to it as a kyphosis, and we're going to talk about that in a little bit more detail in just a bit. But first of all, what is a neck hump? Well, if you have a neck hump, then it's probably something you're a little bit self-conscious about. When you look at someone from the side, quite often what you'll see is an excessive curve of this upper part of your back or the very lower part of your neck. So it's very hyper flexed. And what happens then is the head comes forward and people start looking up. Now, a neck hump is often associated with kind of like this fatty deposit around this hump. In my experience, it's also more commonly associated with people who are slightly on the more overweight side. Generally speaking, it's not a condition that is serious or could potentially be serious. The only thing being that it can cause a lot of neck pain or headaches. But it's not something that's necessarily pathological. So if you have it, then it's not something you need to be overly worried about. For some people, they worry more about the aesthetic side of it. So worrying about how it looks when they're wearing vest tops, for example. So a neck hump really is caused by long-term poor posture, particularly for people who are sitting at desks with their heads down or who are texting on their phone with their heads down for a long period of time. We're talking months and years. So it's a condition that develops over time, very slowly over time. But the good news is that it can be fixed. Depending on how severe it is, it may take several months, may take years, or if it's really severe, then it may not ever be totally fixed. But the more you do, the more consistent you are with the stretches that we're going to go through in today's video, then possibly the better chances of you overcoming your neck hump. Now, quite often you might hear people talk about this being a kyphosis. In my opinion, a neck hump and a kyphosis are kind of two different conditions, although kyphosis means kind of the same thing. So let me explain. When you look at the spine, when you look at a spine from the side, so this is the back and over here is the front. The lower back has this natural backwards curve. This is called a lordosis. As you come up into the thoracic spine, there's a forward bend, which is called a kyphosis. And then back up into the neck, you've got this backward curve again called the lordosis. Kyphosis and lordosis by themselves are not anything to worry about. They're perfectly normal. That's how the spine should be. When someone has an excessive curve, that's called a hyperkyphosis. So instead of it being a nice steady curve, sometimes, particularly in older people, you will see a really pronounced bend, a pronounced kyphosis. This is called a hyperkyphosis. Now this tends to affect older women, particularly osteoporotic women. And the reason is because some of these vertebrae in the thoracic spine have essentially just crumbled, leading to this kind of flexion deformity. But what we're talking about is this region up here in the sort of lower cervical, upper thoracics, where you get this excessive curve just up here. So this is also a kyphosis, but it's only affecting one particular region rather than the whole thing. So quite often the patients I see have a good general straight back, nice normal curve throughout the upper back and lower back, but it's just this region here, this hyper flexed or hyperkyphotic. Now what this leads to is the head coming forwards, which means that inevitably they're going to have to extend their neck even more. Now what this can commonly be associated with is tension in the neck and even headaches due to the tightness in the muscles of the neck. So what we want to try and do is to reduce some of this curvature here in the upper thoracics, and then so we want to try and reduce this and then allow the neck to start stretching back out again. So it normalizes the curves in the upper thoracics and in the neck. So quite often a neck hump can be predisposed by poor posture sitting at a desk or using your mobile phone. A lot of the time you see people with their heads down like this, or if they're sitting at their desk, they'll have a slumped posture like so. So a simple correction people could do, instead of having this upright posture but having the head down, you could lean back into your chair, and that way, even if you've got poor posture with your neck still, you haven't got gravity pulling your head down, whereas when you're leaning back, at least gravity is pulling your head into your spine as it should do. And of course, we still obviously need to work on pulling the head back, but even if your neck is bent, by leaning back, it takes some of that strain away from the neck. So the first stretch we're going to go through is simply just pulling your head back. Now, for people with neck humps, your head is protruding forward. So you've got this curvature here in the neck, your head is jutting forward. So what we want to try and do is pull the chin and head back. Now, what we're not doing is just looking up, because that's only going to make the curvature in your neck worse, and it's not really going to do anything for the hump on the top of the back. So you keep looking forward and pull your chin back. As you pull your chin back, imagine you're trying to lift the back of your head up, rather than just coming back like this. You're coming back straight. Now, this might be quite uncomfortable for many people. So you pull your head back and hold. Now, this might be quite uncomfortable, which is fine. What's happening is the muscles in the front of your neck and at the back of the top of the upper back are going to start working. Now, these muscles have not been working for such a long time that they are quite weak. So by pulling your head back, you're starting to strengthen these muscles. So I would do this for at least 15 seconds, just hold. You might feel a bit of strain going through the upper back or mid back. Once you start to feel a bit uncomfortable, then you can relax. Then have a little rest, move your head, and then lift up the chest, pull the shoulders back, pull the head back, hold. Do that for about 15 seconds minimum. You want to try and build this up. Build it up to about 60 seconds. Over time, your muscles will get more and more stronger, so you'll be able to hold it for longer and longer. So pull the head back, lift the top of the head and hold. If you wanted to, you could do this for repetitions, maybe just starting with 10 and then rest, and then do another 10, rest, and another 10. I wouldn't do much more in terms of repetitions. I would just hold, or a maximum of 10 repetitions at a time. Now, once you've done this for a period of time, let's say you've done it and you're in this kind of upright position, your head is not really fighting against gravity. So the muscles are not having to work that hard. What you can do to progress this, once you feel like your muscles have become stronger, is you can come into more of a bent over position and let your head come down, and then pull your head back. Head down, pull your head back. You can hold, or you can do this for repetitions, again 10 repetitions, but I would do more for a hold. So I would pull my head back, keep the chin back and the top of the head lifted up, hold for up to about a minute, and then relax. Shake yourself out, pull yourself back in, hold for 15 to 60 seconds, and then just do that throughout the day. So the reason why we're bending forward is because gravity is going to be pulling your head down towards the floor. So now you're fighting gravity, whereas when you're upright like this, you have less gravity to fight. So that's a good place to start, and then you can build it up from there. So when we're trying to overcome this neck hump situation, there's two things that we need to be focusing on. The first is stretching. So we want to try and stretch the joints, stretch the muscles, get them longer, get them looser. The next thing we want to be doing is strengthening. And this is so that we can hold those positions for longer. So you need to be doing both. What I would say is if you are in any kind of acute pain or it's very uncomfortable, very sore, then don't overdo it with the exercises, because that could potentially make you a bit sore, especially at the beginning when you're just getting started with all this. So when it comes to stretches, the first thing I would recommend is you just get yourself onto the floor. Take away any pillows that you can and just lie there flat on the floor. Now, your head is naturally like this. So let your head come down. What you might find is you end up hyperextending your neck. So what you want to do is pull your chin down and let the top of your head or the back of your head slide upwards, almost like someone's pulling you this way. So lift the top of your head up and pull your chin down. You can push your head into the floor. That will just start to strengthen the muscles. But I would just lie there like this. So for example, if you're sleeping, this would be the ideal sleeping position. Now, to start with, I would just do this as a stretch. Now, it's possible that you could do this throughout the night. Many of you might be side sleepers or stomach sleepers, so you wouldn't get on with this at all. But if you could sleep like this, then that would help to restore some of that positioning in the neck. But I also know that many of you like to use quite high pillows. Now, these are quite soft, so it's not going to be the best example. But if you are on 2 pillows, for example, with your neck up here like this, then you're already in that hyperflexed position. So instead of having 2 pillows, you could take one pillow away. You could take one pillow away and just let your head come down onto this kind of position. Now, this is quite a soft pillow, so my head will naturally go quite low. But you could be in that kind of position, and then over time you get used to it. If you are a side sleeper, then what I would suggest is maybe starting off the night on your back. So just lie there, listen to a podcast, listen to some music. And then when you want to go back into kind of your normal sleep position, then just stick your pillow in there and just sleep as you would. Over time, you'll get more and more used to it. So then you can start sleeping on your back for longer, and it will become more and more comfortable over time. But if you don't want to do this while you're sleeping, then just do it throughout the day, just lying on the floor without any pillows, just like this. So we've just gone through some very simple stretches and some strengthening things as well. What I will say is this will take time. When you come to the stretching component, let yourself stretch or let yourself lie in those positions for as long as you can. Because your tissues have changed, so your ligaments around the spine and around the joints of the spine, because they have stretched over time, it's going to take them a long time to stretch, or it's going to take them a long time to contract back to how they should be. So stretching just for a few seconds is not going to make a huge amount of difference. So when you're lying down on the floor, for example, or you're lying in bed with a reduced amount of pillows, then just let yourself lie there for as long as you can handle. At the start, you might not be able to handle too long, and you might find that you start to get achy or you start to get a bit of discomfort around this upper region. If you do find that lying on the floor or lying on the bed with no pillows is not very comfortable, then you could try one very small pillow or thin pillow, or you could get yourself something like a yoga block. This is I think it's a standard yoga block, a couple of inches thick, and just put that behind your head instead of a pillow. Once you then progress onto the strengthening side of things, so remember the exercise where you're pulling your head back and holding. Initially, you will probably feel some discomfort in the upper part of your back. That's totally normal. That's just the muscles starting to work. These muscles have not worked for a long time because that's why they've become longer, more stretched and weaker. So we need to strengthen these muscles to start pulling yourself back into a proper alignment. So do the strengthening for initially about 15 seconds hold time, and then building that up gradually to a minute. Or if you prefer not to hold, then you could just do repetitions where you pull in, hold for a second or two, and then let yourself relax and then pull yourself in. So as you're doing this, you're not just pulling your head back, you're also lifting your chest, straightening out your upper back and pulling your head back as well. This is going to take time, so be consistent with it. Do it every day. If you start feeling like you're getting a bit sore in the upper back region in the neck, then take a day or two off. When that soreness goes back down, then you can start reintroducing it again and gradually just build it up over time. This can take months, maybe even years, depending on how serious or how severe your neck hump has become. So just stick with it, be consistent, and gradually you will get there. Hopefully that video has helped. If it has helped you, please let me know in the comment section below and give me a thumbs up. If there's anything else you want to see from me, please let me know in the comments. But good luck with those exercises, and I will see you in the next video.